Okay, good afternoon, everybody. And today we are going to discuss um, bacterial infection, bacterial disease of cardiovascular and lymphatic systems first. And then we move on to another topic after that, try to cover both today. So first of all, let's get some ideas clear. There are different conditions that arise and different terms applied when bacteria enter into circulation. And when bacteria enter into circulation in the circulatory system, just the presence of bacteria in circulation is called bacteremia. Bacteremia is very often results from even small wounds, small things like flossing your teeth, having dental work done. These sorts of things can lead to a temporary presence of bacteria circulating, and usually with no other effect. They are soon eliminated by the immune system, and no actual disease process results. Septicemia occurs when we have circulating, reproducing bacteria in the blood circulatory system. And septicemia is a far more acute and dangerous situation because bacteria are actually establishing a hold, they're actually reproducing. And especially if those bacteria release toxins of one sort or another, that can have very serious effects. One of those effects is sepsis. And sepsis is the immune response to the presence of bacteria or of bacterial toxins of one sort or another. And that sepsis is specifically, results from an inflammatory response of the immune system. And in severe cases, it's referred to as SIRS, systemic inflammatory response syndrome. And this can result in a catastrophic situation where we have organ failure, particularly due to blockage, blood clotting in capillaries and things like that, accompanied by a profound loss of blood pressure. And the loss of blood pressure specifically is referred to as septic shock. And this is really an emergency critical situation with a high mortality. This usually, the most profound septic shocks are usually in response either to gram-negative cell wall components of the outer membrane in particular, or to toxins. It can result, for instance, from gram-positive bacteria which release toxins, but also sometimes components of their cell wall. The first sign that bacteria are moving into the bloodstream and actually reproducing and causing an immune response is very often lymphangitis, inflammation of tissues surrounding lymph ducts, and accompanied usually by swollen lymph nodes. So it's the famous red line that they tell you. It is a sign that something dangerous, potentially dangerous, is happening. And that is that there is a site of infection downstream of this red line. And two things are happening. There can be components of the bacteria or their toxins have been picked up by the lymphatic system and are being conducted towards a lymph node. And in addition, and this sets up an inflammatory condition all along. In addition, we can have cells of the immune system, particularly the macrophages, releasing hormones, immune hormones, as they migrate up the lymph duct. And this causes this prominent inflammation all along the lymph. And this is referred to as lymphangitis. And it is very often the first sign that there is a danger here of septicemia resulting. And of course, it's a warning sign to be on the lookout for sepsis should this enter into wider circulation and cause a more generalized immune inflammatory response. So as I say, this is very commonly from gram-negative components of the outer membrane, especially of gram-negative bacteria. And just to remind you, here's the gram-negative outer structure. We have the cell membrane as normal, a little thin layer of peptidoglycan, but then an outer membrane, and it's these lipopolysaccharides here, which are of particular interest because they are highly antigenic. They excite a very strong immune response, and they are referred to as endotoxins. They're endotoxins because they're a component of the bacterium, very often released only when bacterial cells die. This is one of the complications in dealing with a gram-negative septicemia. Blanket treatment with antibiotics is often counterproductive because you wipe out all of the bacteria, they die, and the cell wall components, the outer membrane components rather, are released and make the situation even worse. This can be a result from a number of different gram-negative bacteria. Klebsiella is one of them. Klebsiella is particularly important in, for instance, in nurseries and in children. It causes a pneumonia, but also causes a sepsis. E. coli can be pathogenic, and we'll hear later in our last class, we'll hear something about foodborne illnesses. There's one group of E. coli in particular, which can set up septicemia and result in a very profound sepsis. This one, Pseudomonas aeruginosa, is another one. This is a gram-negative obligate aerobe, and it is of particular importance in immunocompromised patients, in the very elderly as well, but also in immunocompromised. Treatment has to be very carefully, very judiciously entered into because you don't want to risk wiping out these cells and having mass amounts of lipopolysaccharide components dumped into the system. So very often there are drug treatments which can neutralize these lipopolysaccharides. There are monoclonal antibody treatments to the lipopolysaccharides as well. And also there often is used an attempt to dampen the immune system response. And one of the drugs you will have heard of if you've been following the COVID crisis, and that is dexamethasone. Now, in the COVID crisis, we also often in the severe illness are dealing with an overexuberant immune system, which is causing a dangerous inflammatory condition in the lungs, and dexamethasone is used there for the same reason. It dampens the immune response. Now, increasingly, largely because of development of antibiotic resistance, there are also increasingly commonly gram-positive sepsis is seen in patients, and both streptococci and staphylococci can cause sepsis for various reasons. The one is that they produce potent exotoxins. These are toxins which go into solution. They are not like the outer membrane components, which are endotoxins. These are actually excreted or released from the cytoplasm when the cell dies. And some components of the cell wall itself may also be toxic, and components of capsule as well. And these gram-positive sepsis commonly occurs in hospital settings. And one of the reasons for that is, of course, both streptococci and staphylococci are part of our normal microflora, especially on the skin and nasal passages and places like that where it's kept in check. by the presence of other bacteria. But in surgical settings or under treatment in hospitals, etc., they can actually set up septicemia and result in sepsis. There are two gram-positive bacteria which are commonly associated with hospital-acquired infections, and these are Enterococcus faecium and Enterococcus faecalis. Just remember Enterococcus. These are normal components of the colon, the normal part of our gut flora, but they do colonize wounds. They're opportunistic pathogens, and they can colonize wounds, and they can also are commonly found as urinary tract infections and can be spread by catheters, that sort of thing. And from that, gain entrance to the kidneys and then set up a septicemia and sepsis. They're dangerous because many of them are resistant to even powerful antibiotics. Now, there's one particular kind of sepsis which used to be far more common than it is now, and that is puerperal sepsis, or what is also called post-puerperal fever or childbirth fever. It can be caused by various bacteria, mostly gram-positives, but the one which is most strongly associated with it is Streptococcus pyogenes. And Streptococcus pyogenes is extremely antigenic. It excites a very strong immune response. And this is from poor hygiene during the birth. And Streptococcus pyogenes, if it gains entrance through first to high in the vagina, this obviously after birth, the cervix is open, wide open. The uterus has shed a placenta and is busy healing. This is all ripe for bacterial infection. Under normal circumstances nowadays, rigorous hygiene is engaged in during childbirth. And if there's any sign of a problem afterwards, then antibiotic treatment is instituted. And this has resulted in the collapse of post-puerperal fever as a cause of death, of maternal death after birth. This used to be a major mortality right up until the 1920s, 1930s. In fact, it was still an important, very important consideration in childbirth. But with the institution of antibiotics, it became less and less common. But now with resistance developing in these bacteria, there is something of an increase. But it is still a problem. It is still a problem. And childbirth fever still occurs even in developed countries, even in the United States. But it remains a huge problem in developing countries where often birthing is at home under unsanitary conditions with amateur midwives, whoever assisting at the birth. And Streptococcus pyogenes is transmitted very commonly from the hands. So it is actually a healthcare worker often who is the infective source. And carries a very high mortality rate, a very high mortality rate. Okay, so those are kind of infections which spread in the circulatory system, etc. We can actually have infections which set up directly in the heart itself. As the heart pumps blood, it acquires these bacteria, or it acquires bacterial toxins, and we get inflammatory responses in the heart tissue itself. One of the features of just the mechanics of the heart is that the blood is liquid, and as it flows through the heart, there are eddies and little whirlpools and things around the valves and things like that. Those represent areas where the fluid is slowing down, and the bacteria can actually settle. they can actually, the movement stops and they are able to settle on heart tissue and cause infection. Well, we'll find often that the heart valves are particularly at risk of bacterial colonization. Endocarditis. The endocardium is connective tissue which covers the inside of the heart, and it's inflammation of the endocardium is inflammation of that thin layer of tissue. But that endocardium covers all of the elements of the heart, including the valves. And when that endocarditis becomes severe around the heart valves, then it will impair and damage the heart valves and impair their function. One group that is commonly associated with this are alpha hemolytic streptococci. And you remember alpha hemolytic? Alpha hemolysis is where if we do a sheep's blood plate, the bacteria will utilize hemoglobin. They break down hemoglobin, but they don't break down the red blood corpuscles themselves. It's just a marker. It's a biochemical marker of this particular group. But these often arise, they actually enter into the bacteremia is from oral tonsil infections very often, as we'll hear again in a while. And then enters the bloodstream, and either the bacteria themselves or bacterial toxins can end up exciting these reactions in the heart. Acute bacterial endocarditis is a rampant infection of the endocardium by bacteria, usually streptococci, but strangely enough, Staphylococcus aureus, which is a common component of our skin flora, once it enters the heart, causes an extremely bad bacterial endocarditis. So that is, and severe, these acute endocarditis is often associated with Staphylococcus aureus, and sadly, that Staphylococcus aureus is often very, very resistant to antibiotics and very really difficult to treat. You can also have infection and inflammation of the pericardium around the outside of the heart, and that is referred to as pericarditis, usually streptococci that do that. So this is a bacterial endocarditis, and what has happened, this is the heart valve, and these are the filaments which restrain the valve to the ventricle. And what has happened is bacteria have settled, and they have actually colonized the valve itself. And you can see the breakdown of tissue, the acute inflammation of the heart valve here, and of the endocardium around. And this is normal. This is the normal tissue here, but this yellowish color here, this is probably Staph aureus, which does have a yellow color like that. And this is a post-mortem dissection. This has resulted in the death of the patient, probably the complete failure of the heart valve due to this bacterial colonization of the valves, of the flaps of the valve. Okay, so those kinds of infections often result from this organism, Streptococcus pyogenes. Again, you remember from puerperal fever, Streptococcus pyogenes, once it enters into circulation, is a nasty beast. And one of the problems with the Streptococcus pyogenes is it can have its effect remote from the site of infection. So, for example, Streptococcus pyogenes infection of the throat or the tonsils, something like that, can actually, they will actually liberate toxins into the bloodstream, even if the bacterium itself is not present in the bloodstream. The toxin goes into circulation. The one Streptococcus pyogenes the protein that is released as a toxin is called M protein. And it excites a very strong immune response. And that immune response has focus. And it focuses on the joints, first of all. And it can then move on to attacking the heart valves as well. And remember, this is circulating toxin, not necessarily circulating pyogenes, streptococcus, although that can also occur. But this is called rheumatic fever. It used to be much more common than it is now. Nowadays, these throat infections, tonsil infections are treated with antibiotics before they progress to this. But rheumatic fever used to be fairly common. This is one of the signs of rheumatic fever, and it's these nodules on the joint. These nodules are resulting from immune response to the M protein, which accumulates in the joints. But the M protein also accumulates on heart valves, and the attack on M protein will often proceed to an autoimmune condition where the immune system just carries on attacking heart tissue and ends up damaging the valves so badly that the heart function is impaired. This used in children to be a fairly common cause of heart disease and heart failure in children, much less common now than it used to be. Okay, I'm going to just mention a couple of other bacterial diseases, and particularly ones that you may have heard of. You may have heard of this disease, tularemia. It's caused by a bacterium called Francisella tularensis. Again, a gram-negative rod. This is the distribution of occurrences of tularemia. Tularemia is actually a zoonotic disease. It is mostly associated with rabbits. Rabbits are the principal reservoir. And any contact with wild rabbits or with their feces can transmit the disease. But it's also transmitted by a vector. It can be transmitted by ticks, and it can be transmitted by biting flies as well. And it characteristically creates a little ulcer at the site of entry. And it's a dangerous bacterial infection because it actually manipulates the immune response. It deliberately excites phagocytosis by white blood cells, by the macrophages. But it survives inside the macrophages and reproduces rapidly inside the macrophages. And the macrophages move the bacteria all over the body and ultimately die and release bacteria into the circulation. It's a gram-negative. And so the danger here is that this will set up sepsis, and you'll end up with a true septic shock resulting eventually. It actually has other symptoms associated with it as well. It produces a pneumonia too. And if that pneumonia, by the way, is by inhalation. I'm sorry, I need to explain. It's by inhalation for inhalation of rabbit feces, that sort of thing. The skin penetration one is a 3% mortality rate, which is not prodigiously high. But the respiratory one has a much higher mortality rate of about, it approaches 30%, which is very high. So tularemia is something it tends to be localized. It tends to be endemic to certain areas, and very often people will warn you in those areas. If you go to a farm, whatever, don't touch the rabbits, don't, whatever, because they know that there is tularemia in the area. We do have it, by the way, in New York, but it's not that common. Okay, so here's another one. This is called brucellosis. Now, brucellosis was also known as undulant fever. Undulant fever because it comes and it goes, comes and goes, comes and goes. People feel ill, they get night sweats, muscle aches, and it is very debilitating. It's seldom fatal, but it is debilitating. It used to be really quite common because it's transmitted via milk. And cattle are very easily infected. So are other farm animals. It's also gram negative. Here you can see brucellosis, Brucella abortus infects cows, also various other animals. There's one that infects pigs, and there's one that infects goats and sheep as well. But it's this one, Brucella abortus, which is of particular interest, and used to be very widely distributed when milk was drunk raw. This is one of the diseases which Pasteur developed the process of pasteurization to get rid of. Brucellosis, it can be eliminated from milk if the milk is heated up to about 65 degrees and kept there for a while, and the Brucella vegetative cells are killed. But in old days, in the 19th century, it was a common cause of chronic conditions, and also it got this name here for a reason, that it can result in abortion as well, in miscarriage. That is much more important in animals, by the way, where it can cause epidemic abortion of pregnant cows. Okay, here's a very dangerous one. This is anthrax. The causative agent of anthrax is Bacillus anthracus. And here's Bacillus here. This is very typical. It's this distinct rod. It's gram positive. And in the center there, you see that clear space there. That is the spore. So it is a spore former. It's actually aerobic, but nonetheless, it forms a spore. And the spore is very, very, very long-lived. They have recovered anthrax spores that are 50, 60 years old from areas that's been contaminated with anthrax, and have found that they're still completely viable. So it is extremely long-lived. And the spores tend to accumulate in soil, and they are picked up by grazing animals, and reproduce inside the animals. Animals may have certain tolerance for the bacterium, but they do cause deaths in animals. And in the old days, if people found a dead animal in their herd, right, they went out and somebody died during the night, they would butcher it and eat the meat. And the anthrax could very easily be passed on from a diseased carcass to animals. This is the organism which Robert Koch, worked on to develop his Koch's postulates. Anthrax was the disease that he worked on to show that a microorganism, Bacillus anthracus, could cause a specific disease, anthrax, and that it could be transmitted from one to another. And so this is another of these bacilli that get picked up by phagocytes, by macrophages principally in the bloodstream, and they reproduce inside the phagocytes, get transported all over the body quite rapidly, enter the bloodstream, and begin releasing toxins. The mortality is very, very high. There are different ways to acquire anthrax, though. And first of all, you can pick it up just on the skin, and they enter. Especially if you pick up endospores, they can enter through the most minor of abrasions of the skin. Without treatment, it has about a 20% mortality rate, which is quite high. Ingesting anthrax, you develop an initial gastrointestinal anthrax. It infests the tissues of the gut and then moves to a circulatory anthrax, and that has a 50% mortality rate if it's untreated. So these are anthrax has a number of very, very potent toxins, and the most dangerous situation of all is if you inhale endospores. And that under normal circumstances, that would occur, for instance, to the person butchering the carcass of an animal that had died of anthrax or something like that. But it is also, unfortunately, the basis for using anthrax as a bioweapon, either officially, which is done by governments. They militarize anthrax spores to use as bioweapons, but in non-military as well. And there have been famous incidents where people have mailed anthrax spores to people. They open the letter, the spores fly in the air, and they inhale the anthrax spores and develop pulmonary anthrax. And this very, very rapidly leads to septic shock. And there are a number of virulence factors associated with anthrax, which make this very, very profound and very acute, and it has almost 100% mortality rate. There's very little that can be done. It proceeds so rapidly. Just let me go back one. Anthrax used to be, in the 19th century, was extremely common because people, first of all, were so much more in contact with animals, with farm animals and everything else. But also, of course, because there was no treatment. But nowadays, after exposure to anthrax, you can, if you're quickly treated, then you can be treated with ciprofloxacin and doxycycline. It's also herd animals are widely vaccinated against anthrax. Anthrax vaccination can be used in humans as well, but it's only given to people who are working with anthrax, because our exposure, the likelihood of our exposure to anthrax is virtually nil. But it is a good reason not to ever pick up dead animals in the wild and do things with them, because if they died of anthrax, you could acquire it from them. This is an anthrax lesion. This is cutaneous anthrax. But in this, I should just say this looks like many a necrotic lesion. This would actually have to be sampled to determine whether or not it's due to anthrax. Okay, so here's another. This is another gram-positive bacterium. Again, in this group of bacteria gram-positive strict anaerobes that we've talked about before, these are Clostridia. And this is a particular Clostridium that is associated, again, with something which nowadays is not so common. It does definitely does occur. It is seen with regularity, but it's not nearly as common as it used to be. And that is gangrene. And gangrene is the death of soft tissue, and in this instance specifically, the death of soft tissue due to the presence of this particular organism, Clostridium perfringens. Now, so Clostridium perfringens, first of all, causes ischemia, that is loss of blood supply to tissue. It's a very strict anaerobe, and it releases virulence factors which ensure that it sets up an anaerobic environment for itself. It is spread in the form of spores because the vegetative cells are exquisitely sensitive to oxygen. They die in the presence of any oxygen. But the spores can germinate in a deep wound. And inside the tissues, it very rapidly sets up a situation where this tissues become completely starved of blood and of oxygen, and they begin to die, and the necrosis sets in. And they release exoenzymes which dissolve tissue and very, very rapidly will grow. And in case of Clostridium perfringens, they may produce gas which will swell. The gas is a mixture of foul-smelling products of protein degradation, which is one of the characteristics of gas gangrene, this very appalling odor that is associated with it. And it's the toxins it produces can actually migrate. They migrate through muscle tissue. And so it is progressive, there's this progressive necrosis that develops. Very, very difficult to treat because they can have spread widely through tissue. And it usually requires extensive debridement of the necrotic tissue or amputation of the limb. And it in the old days, used to be a very, very, very common cause of amputations, particularly in military situations, battles, and that sort of thing. Gas gangrene was a common result of wounding of the limbs. Nowadays, it can also be treated in a hyperbaric chamber. A hyperbaric chamber is a chamber that's filled with oxygen under pressure. And the reasoning behind that, of course, is that this is a very, very, very strict anaerobe. Any oxygen present and the vegetative cells die immediately. So if you can force oxygen into the tissues, you can limit the growth of the organism. This is an example of a patient. You can see the inflammatory condition around is very profound, and that is part of the cause of this ischemia, the loss of blood supply to this part. Looks like they may be starting there as well. And the death of this tissue, and then the bacterium will start growing very vigorously, very rapidly inside this anaerobic tissue, necrotic tissue. Here's another disease, also predominantly a blood-borne disease that you've surely heard of, and that is plague. Along with influenza, plague has probably had more influence on human population size than any other disease. In all the way from about the 10th century on to right up to the 15th century. There were repeated waves of very, very virulent infections, epidemics of this organism, Yersinia pestis. Yersinia is a gram-negative rod, and it is a zoonotic disease. It occurs predominantly in rodents, and it is actually endemic in many, many parts of the world, and just remains in the rodent population. The rodents seem to tolerate it pretty well. Here in the United States, it does occur. And when we examine wild populations, you find that it's endemic to rats, but also especially to ground squirrels, prairie dogs, seem to harbor it with no harm to the animal whatsoever. And it is transmitted by fleas. And so it's a particular group of fleas, the rat fleas, that do this. If, for instance, a rat brings the rat with the disease, moves into a house or whatever, and then dies, moves away and leaves eggs which mature into adult fleas, which don't have a host, they will adopt a secondary host, and they will move to, for instance, to a human. And the flea is actually infected with the bacterium, with the Yersinia bacterium, and does something very strange. It actually blocks the... What am I recording? Something bad happened. This has been happening over and over. Oh, yeah. Oh, okay. Oh, I'm sorry. I'm sorry. Something bad just happened. Everything went blank, and then it came back again. And I don't know if I'm recording or not. I hope that I am, that I can just carry on. This has happened. This is now like the second or third time this has happened. I keep losing connectivity. But anyway, I'm all flustered now. What was I talking about? I was talking about plague. Yes. Sorry. Let me get back to here. Let's make sure. I'm just checking everything, making sure I'm still broadcasting properly, and just hoping that I'm actually recording. Okay, so the flea does something really peculiar, or rather the bacterium does something peculiar to the flea. It blocks its digestive system, and the flea will feed, but the blood can't get past the stomach of the flea. And that's where the bacteria breed inside the flea. And the flea will go to the host and will attempt to feed, will bite, be unable to feed because its stomach's blocked, and it will vomit up the blood that it already has in its crop. And this blood pools around the bite that it is attempted to make. And that blood is full of bacterium. And it ends up infecting the blood, moving into the bloodstream, and proliferates. First of all, it moves to the lymph nodes, and it produces this characteristic look. If it does that, it has various ways it can cause disease, but this is the one way. It moves to the lymph nodes and produces these tremendous swellings, very, very painful swellings of the lymph nodes, which are called buboes. And that is where it gets the name bubonic plague. But bubonic plague is only one form of the illness. There are various ways that you can develop illness. So, and bubonic plague can move on from this stage to septicemia. The bacterium, it goes into general circulation, moves out of the lymphatic systems and into the general circulation, and causes a very profound septic shock as a result. And this bubonic plague, coupled with septicemic plague, has a 50 to 75% mortality rate, very, very high. And this disease, in fact, does not only operate through a vector, through the flea. This is something which we don't really understand. This type of plague, pneumonic plague, is infection of the lungs. In looking at the historical record of the Great Plague epidemics, it is evident that all three of these occurred together. The bubonic plague often began with the appearance of buboes, moved on to septicemic plague, coupled with a pneumonic plague. And the danger of this is that this is directly contagious. People developed a violent inflammation and often hemorrhaging of the lungs, and would cough up mists of blood and mucus and bacteria, which could infect people around them. So it spread very, very, very rapidly, and it was almost invariably fatal. This was one of the reasons for the tremendous mortalities associated with the Great Plague epidemics. In modern times, there's a lot of controversy about this, about why it's happened, but we see this. We see bubonic plague and septicemic plague still occurring, and it occurs here and there, everywhere. It pops up, dies down, pops up, dies down. It's very easily dealt with because plague is very easily identified, and it responds well to antibiotics. This pneumonic plague is much more rare, and why exactly, what the trigger is between the different forms is not understood. But fortunately, this pneumonic plague is now extremely rare, which is one of the reasons why we do not see these great plagues sweeping through the human population that much anymore. Periodically you do, but by and large, we see bubonic plague and septicemic. Bubonic plague just popping up because it's endemic in certain areas. It may move to septicemic plague, but we seldom see pneumonic plague, fortunately. Now, this septicemic plague can be extremely serious because this is part of the immune response to the presence of these bacterial components floating in the bloodstream. It causes radical changes in the structure of the walls of blood vessels. And it causes the blood vessels to become leaky. You remember that from the inflammatory response I've talked about before. Blood vessels become leaky under influence of hormones from the immune cells. And if that proceeds to too great an extent, then blood begins to seep out, and especially in the peripheral areas of fingers, toes, etc. Blood seeps out underneath the skin and turns the skin this black color. So that's the symptom of septicemic plague. So here's for the United States, plague is large. The plague bacillus is largely endemic to the western part of the country. And here you can see for 15 years period, there's a number of cases of human plague that have been recorded, very, very low. And it's a reflection of the fact that there are rodents in this area where it is endemic. And every now and again, somebody gets it, but mortalities are very, very low. It's relatively easily treated. Okay, now here come another set of diseases, far more, sometimes far more serious. And these are the diseases caused by spirochetes. The spirochetes are bacteria, which are spiral in shape, but they're not spirular. They instead, they have a flagellum, which is, the cell is wrapped around a flagellum, which runs through the middle of the whole coil. And it allows the whole cell to spin like a corkscrew. Spirilla are much lazier kind of spiral and swim by means of flagella, free flagella, which beat in the medium. The spirochetes do not, they spin, and it's a very characteristic motion, this corkscrew movement. They're also the only bacteria which can move backwards. They can move backwards and forwards. The whole coil is very thin. They're quite difficult to see under the microscope. And we often use a dark field microscopy to diagnose them. There are a number of different spirochetes which are important. The one which causes syphilis, Treponema pallidum, is one of them. But this group that I'm going to talk about now, you will have heard of, because these are the spirochetes which we acquire as zoonotic infections. And they are caused by, and the group, the genus is Borrelia. So Borrelia causes a variety of different diseases depending on the species of Borrelia. And they are usually harbored there. The reservoir for them is usually rodents. And very often these spirochetes are transmitted by ticks. Sometimes they can be transmitted by biting flies, but usually it is by ticks. And relapsing fever is so named because it usually begins with a very acute illness, and then that resolves, and then it returns. And over a period of months, people may have several outbreaks. Each of those outbreaks represents a wave of a reproduction of the spirochete. But in relapsing fever, usually it is self-limiting, but it is treated as most spirochete infections are. They're treated with this antibiotic tetracycline. And the outcome for relapsing fever is usually very good. So it's primarily transmitted by ticks. that feed on rodents, and then inadvertently we pick them up. It has one danger to it, and that is that it does have an involvement with the liver and can cause a liver inflammation and a resulting jaundice, hepatitis with a jaundice. With all of these spirochete-associated things, there is often a skin involvement. So you often have a rash that develops at some point during the illness. So this is the one that you've probably heard of. It is a similar disease to relapsing fever. It is called Lyme disease, and it's caused by this particular Borrelia burgdorferi. And it's the most common tick-borne disease in the United States. In most cases, it is a self-limiting disease. But in some cases, it sets up a chronic condition and can be extremely serious. It's exactly why in one person it does that, and in another person it's a more minor illness is not clear. It probably has a lot to do with genetics. And again, it may have a lot to do with the way in which the immune system responds to the presence of the organism. Now, this is often called, often associated in people's minds with deer. And it's in fact a little bit of unfair to deer, because deer are not the reservoir for the disease itself, for the bacterium. Instead, it's rodents that are the reservoir. But the disease is transmitted by a deer tick, and but by the time the ticks get to feed on deer, they are no longer infectious. It's a nymphal stage. It's a juvenile stage of the tick, which transmits the disease from rodents to humans. And they then move on to go mature more and to feed on the deer. Here is a distribution. And you see this is a northeast disease. And it is really, really quite common, especially with popularity of hiking and everything in these areas. People get exposed to ticks. The tick needs to sit on you for several days in order to infect. So one of the really important things, if you do go hiking, etc., is to inspect yourself for ticks and get somebody to look at parts of your body where you can't see. Ticks, you can adopt all sorts of strategies to try and limit your exposure. Wear tight-fitting sleeves, clothing, tie up the legs of pants, etc., etc. But also do really, really careful inspection. And this is just for 1 year, so you realize it's really quite a common disease in those areas where it is endemic. So this is just a brief life cycle. What we really got to watch is the tick itself. So the ticks lay eggs, and they go through several juvenile stages. And one of those juvenile stages feeds specifically on rodents, and then moves to feed on other mammals, on other animals, and that can be humans. They can at this stage feed on deer as well, but they tend to go for smaller mammals. And when the tick matures, then it feeds on deer. That's why it's called the deer tick. But remember, it's not the ticks coming from deer to humans that infect us. It's ticks coming from rodents to us that infect us. Here's the spirillum here. This is Borrelia burgdorferi. So it has a very characteristic sign, at a sign of a bite, and that is develops what's called a bull's eye rash. There is a central mark here, and then away here, and these are reactions of the immune system to the presence of the bacterium. And this is this is a very strange group of bacteria. Oh, sorry, where am I? Here I am, yeah, sorry. So we said bullseye rash, and people feel achy, they develop a fever, a joint ache, etc., etc. And it can then move on to a much more serious phase, even involving encephalitis and that sort of thing. But the one which bothers people the most is it can settle into a chronic phase, especially with arthritis, which is, again, an immune response, which triggers an autoimmune reaction against elements of the cartilage and things like that. At this stage here, it's quite easy to try to treat. Again, it's treated with antibiotics, and it's treated with usually tetracycline. It's quite difficult to diagnose. If you miss this stage here, which you can quite easily if the bite is somewhere where you didn't notice, it is quite difficult to diagnose. It's difficult to pick the bacterium directly from the bloodstream, for example. So it's usually done with immunological methods, serological methods, or you may also examine for the bacterial DNA components in the blood. This late chronic stage is extremely difficult to treat, and people complain that this third phase here is also associated with neurological complaints such as memory loss, depression, and these kind of symptoms. That's a minority of cases, but they can be extremely serious and extremely debilitating. As I say, why one person reacts one way and other people don't is a mystery. Okay, we're going to move on to another little group of bacteria, a very, very peculiar group of bacteria called the rickettsias. Rickettsias are extremely small, and they are obligatory intracellular parasites. They can only reproduce inside cells, and they begin to sound almost viral in the way that they operate. But this disease that we're going to talk about is called typhus. And typhus needs to be distinguished in your minds from typhoid fever. Typhoid fever is caused by salmonella, and we'll talk about it on Monday. Typhus is a disease caused specifically by rickettsia, and it has a nasty tendency to infect the endothelial cells. Endothelial cells are the endothelium is the lining of the blood vessels, and we saw the equivalent tissue, the endocardium. It's the same thing, but extended through all of the blood vessels. And they are very, very specific cells, very specific tissue, has very specific properties. And rickettsias have a tendency to infect endothelial cells. And this causes all sorts of can cause all sorts of major problems. The rickettsias are almost entirely spread by arthropod vectors, and it can be by ticks, but also by lice. And typhus fever is a louse-borne disease, and it's caused by a specific rickettsia, Proezechii, but you don't need to remember the name. And that is carried specifically by the body louse, Pediculus humanus corporis. The body louse infects the torso mainly. It's not transmitted by a bite. It's actually transmitted, it infects the gut of the louse, but it's excreted with the feces. And lice, when they do a blood meal on you, they will put a drop of feces. They'll emit a drop of feces at the same time. And those feces contain this rickettsia. And the louse bite is itchy, people scratch it like this, and they scratch the louse feces into the wound, and that is how they acquire the rickettsia. And again, it depends on on the person that it's infecting as to its impact. In most people, it is an acute self-limiting illness, and it produces a rash of red spots. That's because of the infection of the blood capillaries, the endothelial cells of the blood capillaries. It causes them to leak and to produce a rash. And it can produce a very, very high prolonged fever, which is its particular danger. In the old days, typhus fever was an extremely serious illness, and it particularly under conditions of crowding and of poverty, because people who were malnourished, for example, and living in crowded conditions were particularly susceptible and could have a high mortality. Typhus fever spreads rapidly through places like prisons, army barracks, and it was very, very common under fighting conditions throughout the 19th century and well into the 20th century. In the First World War, for example, it resulted in high mortalities and very, very high morbidity of soldiers fighting in Europe. But with the development of efficient insecticides, typhus fever has become much, much less common. And in addition, it is easily treated with antibiotics as well, treated with tetracycline and chloramphenicol. But the major reason we don't see it so much anymore is that people with lice get treated for the lice, and so they do not acquire the vector. It is strongly related to a disease here, which we see here in the United States, but which has similar diseases occurring all over the world. And these are the spotted fevers. And the one that we know best here from here in the United States is Rocky Mountain spotted fever. And this is transmitted again, it's caused rather by another rickettsia. But this one is spread by ticks. And a variety of ticks actually can act as vectors and give this to you. In this case, you acquire it directly from a bite. It is injected into you by the tick during a bite. And it depends on the person, but this has Rocky Mountain spotted fever has a much, much higher rate of mortality and of morbidity. It causes quite acute, profound illness in many of the people who acquire the rickettsia. And the mortality rate is about 20%, which is high. So Rocky Mountain spotted fever is no joke if you get it. It's another good reason, if you hike, whatever, to inspect yourself carefully afterwards for ticks and to remove them before they have time to really inject a good dose of the bacterium. It is treated, again, tetracycline and chloramphenicol, as all the rickettsias are. Here is a distribution of occurrences of Rocky Mountain spotted fever. And this is just for 1 year. Again, now this is predominantly East Coast here. But it does occur throughout the country, but much more commonly in the southeast around here. Again, this is transmitted by a tick, and it's there's a reservoir for it, and these are small mammals like rabbits, and again the tick acquires it and passes it on to the secondary host. There is one interesting feature of this, and that is that there is a vertical transmission of the rickettsia. The female tick can pass, if she's infected, can pass the rickettsia because it's an intracellular bacterium. She can pass it easily to her eggs, and the nymphs then acquire it. So they are the nymphs, once it's entered the cycle, they can transmit the disease to all the components. This is just this rash, measles-like rash. This is typical for Rocky Mountain spotted fever. Okay, so that concludes our section on the heart and cardiovascular system. Now I want to talk a bit about microbial diseases of the respiratory system. What I'm going to do is I'm actually going to stop here. I want to check that I'm actually recording. I don't want to record another massive piece. And then I'll set this up as a second part to this lecture.